students. So today we are going to start our next topic for the urinary system disease, that is the renal failure. So as the name suggests, the renal failure, it is a condition in which your kidneys, they are not able to work, or you can say they are just working up to 10 to 20%. Okay, जिसमें कि किडनीज का काम करना बिल्कुल almost खत्म होने के लायक हो जाता है. So the renal failure, it can occur as an acute condition or as well as a chronic condition. In acute condition, that means that the progression of the disease is very rapid, whereas in the chronic disease, the progression is slow, but it can come to acute condition in coming 2 to 3 years or more years. So acute मतलब एकदम से होने वाली कंडीशन, जबकि क्रॉनिक का मतलब है थोड़ी डिले के साथ होने वाली कंडीशन, मगर थोड़े सालों में वो भी वहीं पे पहुंच जाएगी. सो acute renal means that there will be an abrupt onset and it will be reversible, whereas the chronic means progression will be slow, it may take some time, but once it is there, there will be no reversal. It is a permanent renal failure. Okay, so what is the pathophysiology of a renal failure? So in renal failure, they are being divided into two types of their dysfunctioning, that is glomerular dysfunctioning or tubular dysfunctioning. या तो glomerular filtration के एरिया में उनकी प्रॉब्लम आएगी, या फिर जो टिब्यूल्स होती है हमारी किडनीज की, उनके अंदर कोई ना कोई प्रॉब्लम आएगी. जैसे कि if it is for glomerular, then it will be glomerulonephritis, and that means a permanent damage to the glomerulus. Whereas if we talk about the tubes or the tubal part, then it will be aminoglycoside, that is deposition of aminocyte or the protein which may affect the nephrons, and hence there will be damage of tubules. So glomerular dysfunction, as a main function of glomerulus is the filtration. So in simple word, your filtration is going to be affected. In tubular dysfunction, where the reabsorption takes place for the extra material which is going out of the body, which is necessary for the body, that is not going to happen. So there will be very large volumes of urine passage for a person and loss of electrolytes and nutrients. So acute renal failure, that means sudden decrease in renal function. धीरे धीरे ना होके एकदम से renal functions में जो है कमी आ जाना. So acute renal failure is divided into three main categories: pre-renal, intrarenal and post-renal. So acute renal, it is a reversible condition, but it can also cause permanent problem to the kidney. But that is very rare. Okay, normally we can't see that thing, but it can do if you don't take care. The main clinical manifestations which come in acute renal failures is the reduced urine output, that is the oliguria. There may be the presence of edema, that is the swelling, or there may be fluid retention, or there may be high level of urea and creatinine in your serum, and even there will be the alteration in serum electrolytes value. So causes of acute renal failures are myocardial infarction, rhabdomyolysis, decreased blood flow, obstructions, hemolytic uremic syndrome, glomerulonephritis and other conditions. So इसमें सबसे मेन क्या हुआ? हार्ट अटैक, बॉडी में जो है प्रोटीन्स की मात्रा का ज्यादा निकल जाना, ब्लड का ज्यादा फ्लो निकलना, या कहीं पे ऑब्स्ट्रक्शन आ जाना, या फिर यूरिया का लेवल बढ़ जाना, या फिर जो हम कर ही चुके हैं, दैट इज ग्लोमेरुलोनेफ्राइटिस. So acute renal failure can be divided into pre, intra and post renal failure. So what is the pre-renal failure? So pre-renal failure, it is a condition which results from the impaired or reduced blood flow to the kidney. जब क्या है, किडनीज में खून पहुंच ही नहीं पा रहा है, जब खून ही नहीं पहुंचेगा तो खून में से वेस्ट कैसे निकलेगा? दैट main causes for these conditions may be shock, hypotension, anaphylaxis or ischemic formation. Basically ये सारी conditions किससे related है? हार्ट प्रॉब्लम से रिलेटेड है। जब आपका ब्लड प्रेशर कम हो रहा है, आप शॉक में है, यू आर इन स्ट्रेस और इन डिप्रेशन और यू आर हैविंग स्ट्रेस शॉक्स, all those conditions can form pre-renal failure. So intrarenal failure, which occurs or which is a result of damage to the renal structure, as the name suggests, intra, inside the kidney. So anything which is causing damage inside the kidney or to the kidney is intrarenal failure. The main causes for this is acute glomerulonephritis or pyelonephritis, or acute tubular necrosis, or the damage to the kidney structure from toxins, solvents, drugs, or heavy metals. Or you can say acute tubular necrosis is the main cause of acute renal failure. So मेन चीजें क्या है इसमें? या तो ग्लोमेरुलोनेफ्राइटिस की प्रॉब्लम होना, या फिर जब कोई पर्सन जैसे कि कोई ईंटों के भट्ठे पे काम कर रहा है, या कोई लैब में काम कर रहा है, जिस जहाँ कोई खुद ड्रग्स ले रहा है, तो ये वाले जो पर्सन हैं उनके अंदर किडनी डैमेज होना बहुत ही ज्यादा कॉमन हो जाता है. Now the last is post renal failure. This is a condition which occurs when there is blockage of urine outflow. आप यूरिन पास कर ही नहीं पा रहे हो, आपको फील होता है यूरिन सेम एज इन कैलकुलाइज, बट यू कांट pass the urine. So main problem may be due to the urinary calculus, or there will be tumors or some prostatic hypertrophy. So सबसे main चीज क्या है? बॉडी में जो सॉरी किडनी में पथरी होना, ओके, स्टोन्स होना, जहाँ कैलकुलाइज होना, जिसकी वजह से यूरिन का पास ना हो पाना. So the symptoms for the acute renal failure includes there will be electrolyte imbalance, सोडियम पोटाशियम मैग्नीशियम इन सब की वैल्यूज कम हो जाएंगी, यूरिनरी ट्रैक्ट में ऑब्स्ट्रक्शन होना, देयर विल बी ब्लड इन यूरिन, और देयर विल बी रिड्यूस्ड यूरिन आउटपुट, और you may get dehydrated because you are not drinking more water than the passage of urine, or there will be an abnormal mass present around the kidneys, or your skin is getting pale, or you are not taking food. Okay, so the diagnosis can be done on the basis of following things, like you can do routine laboratory test for the creatinine or blood urea along with the routine urine examination, or you can go for the ultrasound of the kidneys, and if the both of above things are not giving you any answer, then you can go for kidney biopsy or computed tomography scan. So the treatment is that you need to support your blood pressure and blood volume, because in renal failure there is high blood pressure, so you need to maintain your blood pressure. Correction of fluid and electrolyte balance. If there is any disturbances in your fluid balance, you need to maintain that by taking ORS. Dialysis, if there is problem in passing urine or any other problem, the main treatment is the dialysis. And then you need to take care of your diet. You need to take low protein but high carbohydrate yields in your diet. Okay, next is chronic renal failure. Chronic renal failure, which is the end result of progressive kidney damage or loss of function. That means this is the end of your kidneys working. Okay, there are four stages of chronic renal failure. That is the diminished renal reserve, where the glomerular filtration is only working up to 30 to 30, 35 to 50%. Then comes the renal insufficiency, where it decreased to 20 to 35. Then comes the renal failure, that is acute, which is the 20% of the normal functioning of GFR, and the end stage renal disease or chronic renal failure, where your glomerular is just working up to 5%. So causes for the chronic renal failures are chronic glomerulonephritis, some chronic infections. There may be renal obstruction due to some calculis, but it will be very prolonged. Then again, you have exposure to the chemicals or the drugs, or you are suffering from diabetes, or if your blood pressure is very high, or your nephrons are not working, or there are some other conditions like Alport syndrome where you will start to have deafness in your body, or your eyes may get defected along with the kidney damage. Then come the polycystic kidney disease. There will be so many disease inside the and outside the kidney. And the symptoms include that the kidney functions remains there, but it may get affected as the condition get worse. There may be anemia because of the loss of the blood. You may get malaise, you will be dry skin, you will not going to eat much, but whenever you are eating you feel vomit, you need to do the vomit. There will be very much high bone pains, or your taste of your mouth will be changed. You may feel as if you are eating some metallic things, and there will be a high abdominal mass. So and these are the various effects and causes of the conditions which we will study in our own lecture at the classes. So the treatment for chronic renal failure includes that you need to take high amount of fluids and electrolytes. You need to use the diuretics for the proper urine passage. Then you need to maintain your diet. Then you need to take iron in your diet so that you can maintain the condition, or you can come out of the condition of anemia. You need to go for dialysis, and if you require transplantation of the kidney, then you need to go for that also. So disorders may affect the bladders and urethra. So that include urine reflex. This is the condition where the urine from the bladder into the ureters or kidneys is moving but in abnormal manner. Okay, then the neurogenic bladder, where the central nervous system or the peripheral nervous system is not controlling the micturition, as in the small babies. They are not able to tell you when they are going to pass the urine. The same condition is going to happen to you. And last is the overactive bladder. In this condition, the urinary tract causes your body to pass high amount of urines. So thank you. I think